In this video, we're going to examine the abdominal series, in particular the function of the oblique muscles, especially external oblique. These muscles are responsible for the control of the thorax and pelvis, in particularly avoiding rib flare, of the lumbopelvic region, avoiding or controlling excessive anterior pelvic tilt and excessive rotation. In particular, they're responsible in compound lifts such as squatting, lunging, or higher level activities such as running mechanics and change direction mechanics, of maintaining control in this region to avoid excessive load to the groin muscles and anterior pubic bone, but also to avoid overactivity to the rectus abdominis and its insertion into the pubic symphysis. The function of the abdominal musculature can be seen across a variety of movements such as squatting, lunging, how we control rib flare and anterior tilt during running and change direction mechanics. Specifically, function can be assessed here, where we adopt a neutral cervical and rib position, place our hands across the chest and lift our legs up into the air. And can we retain that neutral position as we slowly lower our legs? You'll see about halfway down that Danny loses his rib position and his pelvic position. To have sufficient strength, ideally we'll be able to drop the legs all the way to the floor to meet the demands of high-speed multidirectional movement seen in field sports. The entry-level exercise for the abdominal stream is the banded pull down with the hips in a flex position. From here we adopt a neutral cervical position, neutral thorax and lumbopelvic position as we resist the band through shoulder extension. We want to hold this position for 4 to 5 seconds. So the common errors include loss of cervical position, loss of thoracolumbar position. So ideally we want to maintain that neutral position at the cervical, at the thorax and at the pelvis for 4 to 5 second holds. The regression for this exercise is to place the feet on the floor to increase stability and reduce the demand on the abdominals. Alternatively, the progression is again to assume the hip flex position, maintain neutral chin, thorax and pelvis as we introduce the resistance of the band and lower both legs, or alternatively one leg if we want to bring a unilateral bias to the exercise.